pictures used in this presentation were those of a 25-year-old gravid 7 para 4 plus 2 with only a living child who presented at 32 weeks of gestation with a history of 3 previous preterm births, all at 7 months of gestation. First, let's look at what a normal cervix looks like. These are 2 cervices, both at 36 weeks gestation. This image is that of a singleton, while this image was in a patient with twin pregnancy. Note the long and slightly curved cervix, and the normal but straight cervix in a case of twin pregnancy, suggesting that the process of cervical shortening has started in this patient with twin pregnancy at 36 weeks of gestation, while here the process has not started. This is the transvaginal image showing the bladder, the anterior lip of the cervix, the posterior lip of the cervix, the vagina, the external os, what is left of the cervical canal, and the funneling of the internal os. Dilatation of the internal os is actually observed as funneling, and virtually all women with a short cervix have funneling of the internal os. Note this short cervix, which is straight. A short cervix is always straight. Let's look at the video. So, note the funneling, note the continuation of the cervical mucosa up to where the funnel is, and also here. This is taking the measurement of the closed portion. Only the closed portion of the cervix is measured. It measures 1.89 centimeters. Again, note the continuation of the cervical mucosa up to where the funneling is. This approach, which is a transvaginal sonography, is the best approach to measure the cervical length. Trans-abdominal sonography can be used, but that requires a full bladder, which is uncomfortable for many. And an over-distended bladder will forcefully increase the cervical length. Transperineal sonography can also be used, but in about 20% of cases, the cervix cannot be adequately visualized because of shadowing, especially around the region of the external cervical os. Here, the patient was asked to cough. So, note the effect of coughing on the cervical length and on funneling. Thank you.